Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, hospital capacity strained and staffing crisis, but first, no state shutdown and elections 2022. As they say, let's get to it.
Welcome to the fast-paced and unrehearsed weekly discussion featuring the leaders who help shape your world. Join us as we address the issues that impact you each and every day. This is Pennsylvania Newsmakers. And now, here's your host, Terry Madonna.
Well, we have a couple of the state's journalists in the House to talk about some of these important issues. Joining me is Charlie Thompson. He's with the Harrisburg Patriot News, PennLive, and Marc Levy. He's with the Associated Press. All right, Marc, let's start out with this. A year or so ago, we were talking about shutdown, mitigation, restrictions. You go through a variety of things that ended up, part of them in court with constitutional amendments. Looks like the governor's office is saying what?
Yeah, they're saying the vaccine is the strategy. There won't be mitigation. There won't be shutdowns. There won't be restrictions. Pennsylvania is setting records like probably practically every other state in terms of case numbers and hospitalizations for people suffering from COVID-19. But the governor, on one hand, says we have the vaccine. We're in a much different place than we were in 2020. But on the other hand, we have seen their legal authority narrowed through a couple constitutional amendments that Republicans pushed to the ballot. Voters approved them, and that also led to the state Supreme Court throwing out the governor's mask mandate for public schools or for schools and childcare. So yeah, they're saying we have more limited authority right now and the vaccine, and don't expect shutdowns.
So Charlie, those limitations really make it virtually impossible for the governor and his staff, to implement these restrictions that they had last year.
Yeah, well, it seems to be. I mean, they are kind of operating with one hand tied behind their back as far as emergency powers now. But, the one thing that I think everybody could probably do well to remember is that from what we have learned so far about the Omicron variant, it looks like it's a much milder form of disease, and I think that's working in everybody's favor. And I know, I'm no doctor, I'm no epidemiologist, but what I read as a consumer of the news is that people do kind of expect it to play out rather quickly. So, fingers crossed, I think everybody can hope that, maybe by early February, we're starting to see these numbers come down as fast as they went up.
Now, Marc, the state legislature, Republican control, we have a Democratic governor, was not, opposed those restrictions to begin with. So you would think they would be reasonably content or happy with what the governor's doing. Have they said anything? I've not read anything publicly about what they've said. What do you hear?
Well, you have to remember that it was Republican legislators who helped bring the lawsuit against the governor's mask mandate. It was the Republicans who in June, using their new authority under the Constitution that voters approved, ended his disaster declaration. So yeah, they are not saying much of anything. If anything, they are railing against schools that are sending kids home to go remote to try and stop the spread in schools. Those are local decisions, but you have Republicans at the state level who are against that as well.
Yeah, they kind of own the more relaxed approach.
They're more relaxed about it, yeah. Well, look, I want to talk about the 2022 elections. We have a U.S. Senate election, we have a governor's election. They're going to be maybe the most watched elections in the nation. The Senate election in PA could decide which party controls the Senate. Let's run to a break, and we come back. I want to talk about, Charlie, I'll start with you. Let's talk about that. And it seems like every other day there's a new candidate that enters the race. You have trouble keeping track of all of them.
I absolutely could not tell you how many candidates are running right now.
I need the list in front of me. All right, we'll take those subjects, because there's two we're going to talk about after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Well, journalist Charlie Thompson, I'll tell you, I don't remember a time covering elections when we've had, the kind of publicity and interest and debates this early. Maybe I'm living in the past world, but
yeah, well,
my God, and go ahead.
Let me tell you, as a reporter who will have a hand in covering some of this stuff, it's kind of exhausting to think about it the year ahead, because we have this kind of this convergence of three things, right? We have open seats with no incumbent running for governor and U.S. Senate. We are in a swing state in a highly divided era.
Yeah.
As was mentioned before, right. The Senate seat might actually play a factor in deciding the whole majority of the U.S. Senate. The governor's race, obviously, that's the chief executive of the state, and one of the issues there is with the Republicans likely in control of the state house and Senate, are all the levers of the executive branch and the legislative branch in the hands of one party, or do we continue down this road of divided government? And then thirdly, layer on top of all of that, it's a redistricting year, so nobody here in mid-January, we don't even know what the district lines are going to be like yet. It's a very, very, very jumbled picture right now.
And Mark, it's also very complex. I mean, as I said before, I actually need the list. Now, not for the major candidates for governor and Senate, but the fact of the matter is there's so many of them. Some of them are not well known.
Yeah, well, look, nobody I've talked to in the Republican Party can remember a time that there were this many candidates.
Yeah.
There are legitimately 15 people who are appearing at forums and Republican Party functions where they have these candidates, and this is extraordinary in any time. But also on the U.S. Senate race on the Republican field, we've seen 3 people come from out of state to run, all claiming ties of one level or another to Pennsylvania. But the candidates who live here and lived here are working the term carpetbagging into their regular talking points. So it has become a key wedge issue in the U.S. Senate primary for Republicans.
And the 3 candidates from out of state are pretty wealthy. And one of them, of course, is Dr. Oz, and he's been, I think the word carpetbagger keeps coming up for all 3, but more perhaps for him than any of the other ones, right?
Yeah. I mean, David McCormick, former, until recently, of a hedge fund executive from Connecticut, who was the son of the original chancellor of the state system of higher education. Those are his Pennsylvania roots. He was raised here.
Bloomsburg.
Carla Sands, also raised here, moved away to California for about 40 years, was married to a businessman out there.
Actress.
And, did a little bit of acting early on, and she eventually took over the leadership of her late husband's businesses, but and became the ambassador to Denmark in the Trump administration. Is now returning to Pennsylvania. That's number 2. And then number 3 is Dr. Oz. They all have some ability to self-finance, and which puts them very much in the game. And I mean, it's going to be a question for the voters, like, well, how much Pennsylvania root do I demand of my Pennsylvania senators?
Sure.
I mean, did they go to high school here? Is that good enough? Did they go to medical school here? Is that good enough?
Well, we'll be covering it.
And the issues are nationalized. The issues are they're not necessarily rooted in Pennsylvania, right? These are national issues that are being debated in U.S. Senate races across the country. So will Pennsylvanians care if someone really has lived here all their life, or if they've moved here to run? Yeah.
All right, before I let you go, looks like the coffers in the state are full We're not going to be talking about an income tax hike or tax hikes. Spending, where do you think that all goes?
Look,
talking about the state budget, obviously.
The governor's agenda the past couple of years has been destroyed, really, by the coronavirus. They've been in triage trying to deal with that. But the one ray of sunshine for him is that the federal aid has given the state a lot of money to work with, and he wants more money for public schools. And that will be his big agenda item this year, to continue pushing for a lot more for the poorest public schools.
All right, thanks for coming in. Of course, we'll have you back. We have a busy year coming up. All right, we're going to turn to hospital capacity strain and the staffing crisis in those hospitals after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Cross-State Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
All right, joining me now is Robert Shipp, PhD, RN. He's the Vice President for Population Health and Clinical Affairs with the Hospital Association of Pennsylvania. That's a pretty long title.
Yes, it is, Terry. And on behalf of the association, I want to thank you for inviting us here today to talk about the strain that's on hospitals right now.
Yeah, I'll tell you, it's a hugely important topic. So talk about the major features of the strain first.
So right now what we're seeing just this week alone is just increasing the number of new cases compared to where we are now versus at any point during this pandemic. There's so many more cases on a daily basis. And a lot of those new positive cases require those hospitalized beds. So each day this past week, we keep setting new records on the number of patients in a hospital with COVID-19.
Well, in addition to that, there's also the flu, there's seasonal illnesses, a greater need for care because people may have put off getting, surgeries or other kinds of treatment in hospitals and seeing physicians as well, correct?
Yeah, and really there's a couple contributing factors to that. So I know one of the things that we'll talk about is staffing, and that has a wider impact on the healthcare system than just the hospitals alone. But there's this increased surge right now with the Omicron variant. When COVID first entered the state, we had a lot of positive cases. And then as it sort of transitioned over to that Delta variant that we had about 9 months ago starting, that was thought to be about 13% more contagious. And now with Omicron, it's like 70%. So it's very easy to spread. Spreads like the common flu.
And I want to talk about that in greater detail in a moment.
And so that increased capacity just from that volume alone. Plus, like you said, people that have put off surgeries, people that may be in a hospital waiting on behavioral health services or outpatient services like that, trying to get back into skilled nursing facilities. Those are a lot of the things that are all contributing right now to the demand, plus now entering into flu season on top of that.
Yeah. Well, when people put off, let's say, having surgery, it has to be incredibly challenging because that adds another dimension to their health care.
Yeah, and if they put it off long enough, they may be more of a complex case when they present, right? If you catch something early, it might be an easier way to treat it versus if it's caught later, it might require additional surgeries, more intense therapy, things like that.
And it's not new. I mean, the staffing shortage is not new.
Yeah, we had a staffing shortage on nurses and RNs and on physicians and all sorts of healthcare support going into before the pandemic.
Yeah. Well, we chatted last week about the emergency rooms and what's going on there, and we heard the same story about the challenges because of the staffing situation and dealing with people who come in for treatment, and there's no one there. I shouldn't put it quite this way, but there's no one there to actually help the individuals because of the staffing shortage, and they line up and beds in the hospitals. I mean, that has to be horrific.
Yeah, I've been on a lot of calls with physician leaders and hospital leaders this week, and almost every hospital is at capacity, like where they typically have the number of beds and what they can treat. And there's quite a number that are well beyond that, 120%, 130% of where they should be. And so that's taking care of all the people that come in that need help. They think, it's important for them that they have some ailment that they want seen. And that increases those wait times in the emergency department. It increases the number of people that eventually end up leaving without treatment. It puts hospitals sometimes on divert for a couple hours where they can't really take new ambulance patients and things. And so it really can back up the system on the emergency side.
Is the staffing shortage and the strain consistent throughout the state? Is it urban, suburban, as well as rural?
Each of them have challenges as it is. Before the pandemic, a lot of rural challenges with staffing, those still exist, but now also in the urban areas, they're the ones that really saw the influx of COVID patients, so had a lot of staff treating them very intently, put in a lot of overtime, and kind of, just they want a bit of a break, and they're either cutting back on their hours, they're taking different positions, getting out of healthcare, that sort of thing.
All right, let's run to a break. I want to talk about the Omicron variant and the degree to which that has a huge impact on hospitals. We'll do that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine.
All right, the Omicron variant has been a huge factor in the challenges that hospitals face.
Yeah, and the way that it's really kind of spreading in the public right now is it is a problem that we need to address by doing, some of those things that we've asked the public to do along the way, the wearing the mask, the good hand hygiene, the social distancing, things like that, just to put some, perspective on it. On Sunday, I've been keeping a tally of cases ever since March 6th of 2020, when Pennsylvania experienced its first 2 cases. And on Sunday, I went back and I was looking at the last 5 days, so the end of last week through Sunday. There were 117,000 new positive cases in Pennsylvania. So that's a lot. All right, that's over 20-some thousand a day. Yesterday, there was 31,000 cases, so it's getting more. And I went back and I looked at the first year of the pandemic. March 6th, when we hit 117,000 cumulative patients in Pennsylvania? It was on August 8th. So March, April, May, June, July, August. It took 5 months that first year to hit what we just had in 5 days with this variant. Now, we're doing a lot more testing and things like that, but still, just to show you how much more volume there is now of new cases.
Yeah. Now, when you talk about Omicron versus Delta, is Omicron more likely to produce folks who are asymptomatic?
Well, we're learning more about that each day. There was just a study just this past week that came out of Kaiser Permanente and the CDC out of California, and through California. It looked at 70,000 patients, and through that, it appears that about 74% less patients required an ICU that had the Omicron variant. There was like 91% fewer deaths. None of them were on a ventilator in that study. So it does point to some evidence that it is likely we get you get less acute symptoms and shorter lengths of stay, not necessarily requiring those hospitalized beds.
The other thing I've read a good bit about is child cases, which are up, can I say significantly or just modestly?
Well, over the past 2 weeks, it's pretty concerning. So for about the past 18 weeks, I believe, the Department of Health on it's either Thursday or Friday, they released a number of cases for children aged 0 to 4 and then 5 through 18, sort of the school age numbers. And when I looked 2 weeks ago, sort of like the week after Christmas, there were, for the school age kids, there were 12,500 new cases that week. Last week, that number had jumped up to over 20,000. So almost 2 times as many cases in 1 week alone. So these week's numbers will come out tomorrow, or I guess a couple of days ago when this is being filmed, but it's a concerning trend that we're keeping an eye on, working with our pediatric hospitals and hospital capacity to make sure that they have those beds should they be needed.
Now, are there still far fewer children who are in hospitals than adults, you know, comparing them in terms of the numbers of them who have the virus?
Well, we have fewer pediatric beds in Pennsylvania than we do adult beds, right? So we have much more volume and capacity there. And we're working with our pediatric hospitals to make sure that they're able to meet that demand. Because, you know, sometimes if it's a complex case where a child has other sort of conditions, it may impact them more acutely than somebody who does not.
Well, are you optimistic, or I won't say pessimistic. How optimistic are you that this is going to end, that we won't get another variant and we'll get somewhat back to normal?
Yeah, December of last year when we had the virus or the vaccine hitting, we thought, oh, good, right? We're out of the woods. We're all going to get vaccinated. And then Delta came, and now it's Omicron. So it does get it gets tiring, right? And fortunately, this newest strain appears to be less impactful on health, but it is a lot more contagious. So, you know, is that a good sign that people are less ill today than what they were 9 months ago? Maybe, but there's still more people being sick. So, you know, hopefully we don't see another variant, or if we do, it's a less severe variant. But at this point, it's one of those, it's a challenge that as healthcare workers, we step up to the plate and we meet those demands every day.
Yeah, well, one thing I think that hospitals are, and physicians in general, they are more and more learning how to deal with it. And the fact of the matter is there's still a large number of people who have not been vaccinated. And I'm not talking about the exceptions. In some cases it's religious, in some cases pre-existing conditions that physicians say don't get vaccinated.
Yeah, and there's, so we encourage vaccine, right? And especially if you've gone through your primary series, if it's been 6 months or some of these like 5-month things that just came out, we want you to get that booster. And I just heard on a call yesterday that...
Thank you. I hate to interrupt you, but they're telling me we're out of time.
Okay.
Thanks for coming on. We'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.